All right, good evening, everyone. This is Angela McGowan. Happy Monday. I'm trying something different, so I'm trying to see if I can get it to work. We're going to hope for that. I don't see it working. Okay, as a matter of fact, I don't see it at all. Let's see. Let me do it. All right, just give me a. Oh, there, I do see it. Okay, beautiful. It is working. And not like that. All right, just give me a. All right. So anyway, this is going to be interesting. All right. So good evening. My name is Angela McGowan, and I am a professional healthcare advocate. And I'm part of the Alliance of Professional Healthcare Advocates. Let's see if I can turn that. I think I hear like an echo myself. Okay. So I create solutions that enable you to receive excellent health care because it's your right and not just a privilege. All right, so just a little bit about me. I don't know what that is. It's driving me crazy. I was in healthcare for about 20 years, and I help patients and their loved ones to obtain excellent health care in all areas by providing them with opportunities to receive assistance for themselves, for their loved ones, and for their caregivers. So, and now as I'm a private independent patient advocate, my allegiance is to you and your loved ones that need my help to ensure that excellent health care is obtained and maintained for you and for them. So, as you know, open enrollment for Medicare has begun, and today is actually day 2. And open enrollment will continue through December 7th of this year. So I've done a little research, and I found 10 things that you need to consider as you review and or choose your Medicare options. So we're going to go over 5 of them this evening. So here are some questions that I'd like to pose to you, and I'll give you a few answers depending, so you can just sort of see what's going to go on if this is your first time enrolling, if you're making changes in Medicare. There's a lot of things to consider. So number 1, are you still working or covered by an employer or retirement plan, like either yours or your spouse's? Okay, that's very important. If you are still working, that would mean you don't need Medicare B. If you have a spouse that's working, you don't need Medicare Part B, the physician part. All you would need is Part A. And depending on that coverage, you would not even need the supplement prescription for Part D. All right? And so the next question does talk about, do you want or need coverage for prescription drugs? Now, again, like I just said, you don't need it with Medicare. You don't need to get Medicare Part D unless you are not working, you don't have a spouse, or your spouse is not working. In that case, you will either have to join a separate Medicare D drug plan. You could enroll in Medicare Advantage. They call that the MA plan, and that includes drug coverage. And all Medicare Advantage plans provide Part A, which is your hospital insurance, and Part B, medical insurance for your physicians. And most of them do offer drug coverage as well. Okay, so that's if you want or need prescription drugs because you are not working and you don't have a spouse that works. Now, do you think you may want or need extra coverage? You may want to consider Medicare Advantage plan or the original Medicare plan, which is Medicare A, Medicare B, and also get Medigap, a Medigap policy. Now, the Medicare Advantage plan is going to cover, like I said, all the original Medicare plans, but the Medicare Advantage has extra coverage, okay, which will include your drug and other benefits like vision, hearing, dental, and wellness programs. So you have a lot of things to consider if you're going to go for Medicare Advantage or the original Medicare plan. A lot to consider. So that's why I said, let's start early. Let's find out the facts. Let's look at things so that you have time to make a very good decision that's going to take care of you the entire year, okay? All right. Is a doctor and hospital the choice very important to you? Have you been with a certain doctor or gone to a certain hospital for quite a while and you don't want to change, you don't want to budge, you don't want anything to be different, all right? If that's the case, then enrolling in the original Medicare allows you to select any doctor in the U.S. that accepts Medicare. So no matter where you are, if you're traveling in the United States or not, you stay home. You can go and see a doctor, and Medicare is going to take care of it, as long as they accept Medicare, okay? That is important as well. Now, the Medicare Advantage plans generally require you to use their health care facilities, operating very much like an HMO, okay? The doctors, the other professionals in the Medicare Advantage plan are in a network. So in some plans, you may need to have a referral to see a specialist. There are plenty of ways that you can review all the Medicare Advantage plans to see if you want to deal with preferred providers or just accept flat coverage. Again, that is an important decision, one that you definitely need to research, okay? And number 5, do you travel a lot or live in another state part of the year? If that is the case, you may want to consider the original Medicare, okay? Because remember, the original one allows you to see any doctor in the U.S. that takes Medicare. And you can also add to that original Medicare, Medigap. Because if you travel, and let's just say not just in another state, but out of the country, you would need what Medigap offers. And they do offer coverage internationally, all right? Now, the Medicare Advantage plans, they generally require you to use, like I said, their facilities, their doctors, their network, so that can limit you to not just a state. You could be limited to a county. So again, this is day 2. So these are 5 things for you to consider, and a lot of things that you'll have to look up and make decisions on, which is why I want you to use every possible day you can to wisely make that decision. Now, if for some reason this is your first time, you don't, but there's no one you feel that can help you, let me give you some information. Your state, no matter what state, your local state health insurance program is called SHIP, S-H-I-P. They have counseling at no cost. You can simply get 411, Google, whatever your state is, if you live in California, Nevada, Arizona, Pennsylvania, wherever you're living, you can go and look up the State Health Insurance Assistance Program, and they will at no cost help you go through the different Medicare supplements and the different scenarios that you would incur during this next year. Okay, so it is important that if this is your time of enrollment, if you want to make changes, please don't dilly-dally and hesitate. I know you're saying, Angela, it's only day 2. But remember, I told you, there are over 58 million people that are on Medicare. So you need to be proactive. You need to get enrolled. You need to make your changes. Whatever it is you need to do, just get it done. Okay? So thank you for joining me. We'll be back next Monday talking about Medicare again. And I'll give you the other 5 things that you need to consider as you choose whether you're going to have original Medicare, you're going to do Medicare Advantage, you're going to do Medigap, or a combination of those 3. All right? So I hope everyone has a super duper excellent week. Stay blessed. Bye.